Center today. It is a pleasure to have you on our property. Today, I have opportunity to introduce some new technology, which is what I like to say is going to be groundbreaking, at least for us in Cobb County, if not across the United States of America. This technology we're going to introduce today is going to help us better monitor our inmates population, and specifically those under care while they're here at our facility. So without further ado, I'd like to bring up the president of Black Creek, who's going to explain this device to you and what all it can do. Again, I think this is a groundbreaking event for us today. I'm so happy that Cobb County Sheriff's Office will be one of the first in the state of Georgia, not crossing the nation, to have this technology. And again, it is for the betterment of our inmates and our population here, and for overall health and wellness of our population. Mr. President.
Thank you, Sheriff. Morning, guys. My name is Isaac Newton. I'm president of Black Creek Integrated Systems. And yes, a direct descendant. This is my partner and vice president over here, Brady Hughes, who is VP of Engineering of Black Creek and is a great deal responsible for this particular product that we're going to talk to and show you today. Briefly, Black Creek has been involved in corrections exclusively. We're a little over a 40-year-old company. We've been involved in corrections exclusively since the mid-'80s. Providing technology to corrections has given us, as civilians, a really unique insight into how jails and prisons are run, their needs, not only the facility's needs, but also the inmates' needs. We pride ourselves on being a supplier of technology to corrections. And what we're going to talk about and show you guys today is basically the latest iteration. And what the sheriff said is exactly true. This is a first in the country for this technology. And in my view, blowing smoke up his skirt, the sheriff should be commended for his forward-seeking views on this. The technology that we're going to show you is a body-worn technology that is designed to do several things. The first thing that we're going to do at this facility is we are going to put this body-worn technology, which Brady will show you here in just a minute, on at-risk inmates in the facility. Corrections statistics are kind of subjective and a little bit hard to come by. But suffice it to say, the United States incarcerates more people than any other country in the world. In all correctional facilities, mental health facilities, forensic mental health facilities, juvenile facilities, we're incarcerating about 2.3 million people in the U.S. Y'all need to fact check that. That may be a little bit old information because that number is going up. In our association with corrections and correctional facilities, what we know empirically is that inmate in-custody deaths are increasing. There are really some good reasons for this, and society is going to have to figure out how they're going to come to grips with it. The problems are multifold. They relate to a lack of money. They relate to a severe shortage of staffing. As long as we've been working in corrections, every facility that we've ever worked in, every agency that we've ever worked with has been understaffed. It is a difficult, thankless job. And in this time of, I guess I would call what other people would call, I guess, the Great Resignation, people are very, very hard to come by. So the agencies really have no choice but to turn to corrections to solve these problems. So what we're going to show you today is a multi-layered strategy. We're going to start the strategy with the most at-risk inmates. We will be monitoring their location, and we will be monitoring, in this particular case, their blood pressure. Excuse me, their their heart rate, I'm sorry. Blood pressure is yet to come. Suicides are the leading cause of death in jails currently. Followed right behind it, I think, is heart disease, and right behind that, oddly enough, you wouldn't think so, you think they'd be reversed, but drug-related deaths. So if we can, on these at-risk inmates, if we can catch them at a moment of vulnerability and intercede, take action to protect that inmate's health, we are going to be able to take some positive steps to reduce in-custody deaths, which, as I've already stated, we know empirically, I can't give you the statistics today, but we know empirically are rising dramatically. So once again, the sheriff should be commended for his foresight in doing this. This is going to have a significant positive impact on the incarcerated population here in Cobb County. The next phase of the project, if I can speak of that, the next phase of the project will be related to, and this may sound a little odd, but tracking location history of everybody that's in the facility, and not just doing it on a rough approximate basis, but down to about 1 or 2 meter accuracy anywhere in the facility. Stick that information in a database every couple of seconds, and all of a sudden we have a history, location history of everybody that's been in the facility or currently is in the facility. So what we're going to show you today is just simply the first phase of the project, which is just a very brief, not particularly spectacular demonstration of the heart rate monitoring that we're going to be doing for inmates. And what we know from this same technology from our company that's about 10 years old, what we know in prior deployments with the tracking piece is we know that inmate-on-inmate assaults decline. We know that inmate-on-staff assaults decline. And operational history becomes far more transparent in a correctional facility. And transparency is very, very hard to come by. I don't think people are being disingenuous. It is just simply not information that's readily available. That information is going to be readily available in the next several years, but the emphasis here at Cobb County, kicking this thing off as it should be, is monitoring the health of at-risk inmates. Brady can show you strapped to his wrist. Brady looks like I don't know, he kind of looks a little bit like I don't want to call him a felon, but definitely somebody that the public has interest in his location. But that is the Bodyworn Device. And it is very lightweight. It is about a third of the size of the previous technology that we had, which frankly was not particularly successful, commercially successful, due to the fact that technology, while we could track very accurately, the body-worn technology was not particularly up to the task. It is now. That is a very lightweight device. It has an extended battery life. It is designed to be waterproof, and it is designed for use in a correctional environment. It is secured to the wrist with a special clasp that needs a tool both to install it and to release it. And the single most important feature of that technology, it's somewhat less than half the price of the previous technology. So technology is doing what it does. It drops in cost and it increases in capability. So what we're seeing is a convergence of that here at the Adult Detention Center. And to repeat myself, I'm sorry, I have a habit of doing that. It is going to have a significant impact on the health of the inmate population, which basically is what this is all about. I have nothing else, Sheriff.
What I failed to mention in the beginning, as I ran for office, we want to do everything we can to prevent deaths in our facility. So unfortunately, in my years of service, since I've been here a little over a year and a half, we have 6. And that is something we're trying to do every day to figure out what we did right, what we did wrong, and how we can be better going forward. And with the manning issue and things we have, we know technology is a way that we have to go forward to be successful. So that's the reason why we look for some technology help to help us improve the overall safety of our inmates / detainees in our facility. And we think this device here is again, of course, to be one of the first in the nation to use, but one of the best ways to start that. We're starting out in our first phase should be, as he said, down in our high-risk inmates, but it's with the blood pressure, but he also have works in the future to do oxygen levels and things of that nature as well, some other enhancements to the system. But our overall goal is to keep everyone safe that comes in the Cobb County Detention Center. And that is something we all strive hard to do here, because once they come into our facility, they are under our custody, care, and control, and they are due the best possible mental and medical health care that we can give them. And that's what we're going to do. But we're going to achieve some of those things by technology, because we just don't have enough people to do some of the things we need to do. But we'll improve this by increasing our technology level. And I think this is the way to start it. And Cobb County can lead the way down in the state of Georgia, across the nation, with this new technology and helping to keep inmates safe inside our facility. So that being said, Colonel Atkins will be getting ready to break us down into a group so you can go actually see the device, how it works, go down into one of our secure locations where you can see it, and actually go through the whole demonstration process. But I also would be remiss today if I did not introduce other people behind me today. I have Chief Deputy Ron Anderson, who's here today as well, Chief Michael Register, and of course, my jailer, Colonel Pete Atkins. That being said, I'm going to turn you over to Colonel Atkins. He'll get you ready to go down to the demo location. And then after demo location, we'll be coming back here for any last-minute questions or comments or concerns you may have with me as well. And I also do have our medical staff here on board with us today. Well, Pastor's here. Also, they sit in the front row as well. So our medical staff is here as well, because they're a vital part of what we do as well in trying to keep our inmate population safe. So with that being said, Colonel Atkins.
So, Sheriff, you want to keep the questions to the end?
Yes, please.
It is a hypoallergenic device. It's got a stainless steel pack. You'll see the lens back there where we monitor the blood flow. It is an extremely tough device. So here is a situation of high heart rate. This is a zone that will be on a single zone that'll be much large to shut it off by an officer, and we log who acknowledges the alarm. And then to close out the alarm.
Again, thank y'all for coming out today and see some of this new technology we're trying to bring into our facility. Again, my overall goal and our overall goal as the Sheriff's Office here in Cobb County is try to provide the best mental health care and just general care, period, to detainees / inmates in our facility. I think we owe that to every citizen of Cobb County, or every citizen, period, to walk through these doors where I'm in charge of keeping them safe. So we're going to do everything we possibly can now and in the future. And again, earlier he came a little late. Our district attorney is here. Mr. Brody Flynn is here. He's in the back. He's supporting us in some of the efforts we do in our technology upgrades and things of that nature. So we all trying to work together collectively from our total law enforcement family here in Cobb County to not only make this the best facility in the state of Georgia, but maybe even the nation. And we're working extremely hard to get there. And again, this does not just start 2-3 weeks ago. This is something we've been working on since I took office a year or so ago. So we just did not implement this plan to try to start doing things because we had some incidents. This has started a long time ago, because when we took office, we knew we had to make a change. And we knew we had to change the way we do business. And that's what we're trying to do here, change the way we do business here in Cobb County, specifically at the Sheriff's Office, and provide the best possible care we can. We've been transparent. We've been open to any requests that we can possibly answer. We answer them. If you want to come by and take a look at our facility, we open the doors. It's never been done before. It's always been a pretty much closed facility. You can come across a guard line. We've employed new healthcare providers. WellPath has been doing a great job for us. And they're here today again as well. I want to mention them because they've been doing phenomenal work for us since they've been on our site. So I think we're putting our best foot forward. Again, are we perfect? I would tell you absolutely not. I don't know anybody who's perfect. This profession is always ever evolving, but we're trying to do everything we can to stay in the current times with everyone. We send people to conferences, to schools, to better our education, our professionalism here at Cobb County Sheriff's Office, to try to make us the best around and to provide the best possible service. People would ask you what's different now and what it was during current administration. I can tell you saw some of the differences, the technology, what we're putting into place, being transparent, trying to do everything we can to take care of everyone that walks through these doors, which is what I think we owed to our citizens. So with that being said, I will answer any final questions you may have this evening. And again, I sincerely appreciate each and every one of your time today to come by and see this technology that we're sending out into the correction facility. Yes, sir.
Sheriff Owens, I don't have a question per se, but as a citizen, I would like to take this opportunity to thank you and your entire staff for your cutting-edge leadership. I heard you say today that the device is groundbreaking, but Dr. Ben, I'd like to take it to another level. I think what you're doing today is game-changing. It's going to actually change the game. And so thank you for being not reactive, but proactive. And thank you for all that you do. And we're here to support you 101%.
Thank you.
Can you give some indication as to how many of these devices will be purchased, how many inmates might be wearing them at any one time?
Well, right now, we're going to begin in this first phase will be just in our healthcare ward, which is where you saw. And as we complete that and all the process, everything works as we know it will be, then we will expand into our facility. We can hold over 3,000 inmates in our facility. So the goal is, once everything is done, to start in our health ward, then expand to the entire population. As being when they get processed in, they get a watch snapped onto their wrist so we can monitor them as soon as they walk in the facility. So that's the overall goal for the long term.
Specifically the inmate wearable, how long does that battery last and how does it get recharged?
Now, I don't know. That's probably more of their question. They can answer that question for you. The total battery length time?
Typically about 90 days. Depending on the model of the device, there are different models essentially of the same device, but they change depending on the duty of the device. So for example, you're in a sentenced long-term facility, you don't want to be changing batteries every 90 days. So that same device, if you are not monitoring heart rate, for example, has got a battery that's good for 3 to 5 years.
But we will be monitoring heart rate, so it won't be that long. Make sure you understand.
Heart rate monitoring will run about 30 to 90 days, but if you look at the average length of stay in the facility, which perhaps Colonel Atkins can tell you what it is, it's not going to be onerous. When an inmate leaves, the device will be taken, it will be cleaned, the batteries will be not charged but changed, they're with a coin cell battery, and prepared for the next inmate use.
Exactly. We purchased extra devices so that we can switch out. So once the person's released, then we would switch that particular battery out so that the next person comes in with a brand new battery.
Would every inmate that comes to the facility have to wear that? Would they be required to wear that, or can they decline?
Well, there's no declining. They'll be required to put it on.
And of course, in May, you've had a couple of deaths, unfortunately, at the jail. Do you think this device would have helped save some of those lives? Or?
Well, that's a good question. For suicide, it's hard to say. When people are determined to hurt themselves, there's not a lot we can do sometimes. We try to do everything we possibly can to prevent that from occurring. But that's just something that's a very unfortunate act. When someone's determined, they're going to get it done. But we try to respond as quickly as we can, perform any life-saving procedures we can to try to bring them back if we can, and get them to the hospital, and hopefully get them back to life. But that's all we can do with those. And again, I stated in the beginning, we had 6 unfortunate incidents of deaths in our facility. And I'm not proud of that. But if you look around the metro Atlanta, we're no different than anyone else. I don't want one death. One death is too many. One is too many. But when we have people doing things that to themselves or want to hurt themselves, it's very hard for us to try to prevent that. We put every precaution into places that we bought new suicide marks, we bought suicide mattresses, everything you can think of we're doing, and spend a lot of money to try to prevent that. And we will continue to do that, and I'm hoping this technology, hopefully, will help us prevent one. But I can honestly say, and I'm not a fool to tell you something and say it won't occur, But if someone destined to hurt themselves, they're going to do it. But we're going to do everything we possibly can to prevent it and get alerts to try to get the most medical treatment we possibly can, hopefully save someone's life. And that's what we're here to do, try to save someone's life and get them out of the facility safely.
Sheriff, how many of those deaths were suicides just in the last year, would you say?
We have, in my year and a half here, we had a total of 6, and 3 of those are suicide.
And was that just recently? I mean, how many suicides have there
This year, we had 1 suicide and 1 that has not been determined. A young lady did not awake from sleeping. Did I miss one?
There was one additional one, correct?
One additional that was suicide, so 2
Yeah,
suicides.
I'm sorry, 2 suicides this year and 1 young lady who did not wake from sleep.
Sheriff, respectfully, it kind of seems like this is treating the symptoms and not the root of the issue, which seems to be mental health among inmates. What are you doing to confront that?
Excellent question. So we have a mental health platform here, which is the only one in the state of Georgia now that goes 24 hours. So we brought that department in, which is WellPath, who's here on the front row, on the second row rather, and they're here. We've got the mental health professionals here on our site. We're the only one in the state of Georgia giving you 24-hour coverage, only one. And so we're doing everything in that aspect too. They're getting treatment. They've been whatever they deem necessary for them to get, they're getting it. We're not sparing any costs in giving them the right treatment. So we're doing everything we possibly can to help anyone that comes in the facility have mental health. Let me tell you this, probably over 70%, if not more, of our population have a mental health problem. That's a lot of people. But let me tell you this also so you understand this clearly. Make sure you understand this clearly. That's not what the sheriff's office, not only my office, no sheriff office across the state, we're not mental health professionals. That's not what we do. We're correctional, and we're here to hold them until they have their day in court. But I'm not here to perform mental health services, but that's what it's turned out to be because
But
our
you're
population.
keeping them alive, right?
Absolutely. So we're doing everything we can to do that. And we got trained professionals in from WellPath to ensure that we're doing that as well. But we're spending a lot of money into that, and we'll continue to spend money in it to keep everybody safe that come to this facility.
So that's around the clock counseling, psychiatric services, what is it exactly?
Both.
Both, okay. And how much is this technology costing taxpayers?
How much it costs?
Yes.
Too much money. I'm just kidding. Well, at the moment, since we're in the demo phase, we haven't came with our final cost estimate yet because we're going through the final demo phase and see how everything is going to work for us. But we're thinking, and I let him tell you that because he's going to tell me what the final is going to be. It's going to really depend on how many devices we have. So once we determine how many we're actually going to have and we're going to issue out, then we'll get a great cost estimate. I'll be basically giving you a swag now, which probably won't be accurate. I don't want to say, well, Sheriff said it's going to be $100,000. The next thing I know, we got a taxpayer got a bill for $500,000. So I won't give you an estimate because I don't really know until we determine how many devices we're actually going to deploy. But again, we can hold well over 3,000 detainees / inmates in our facility. And that is the eventual goal.
It depends on whether you buy it or whether you lease it.
I see. Well, what are the two different?
In a facility of this size, of this is a 3,500 bed facility. If you equipped everybody, probably about $100 a device. We also are looking into addressing a problem that we see coming up and nobody really even knows about yet, is the maintenance of these devices on a large scale. And what we're thinking about doing is actually just renting these devices, just 50 cents a day, just throw a number out there for something like that. And it's actually a pretty cheap price to pay to protect an inmate's health.
And there are different, I don't mean to come up, there's different ways to get this done, from grants that the federal government offer for corrections and things of that nature. There are different funding avenues we have to look into to help pay for this as well, and keep it off of our taxpayers as much as possible.
Can I step in?
$100 a device, is that the purchase?
Yes.
One thing I want to say is that, and the sheriff will be a little bit, not kind of speaking up for himself, but what he's negotiated is that we won't pay a penny until the sheriff is satisfied with this particular equipment. So if it doesn't work, Black Creek has said that they would just take their stuff back to Alabama with them at no cost to the Cobb County citizens. But they're adamant that this is going to work and this is going to be great for the Cobb
But
County
as you
citizens.
saw today, it's looking bad for the sheriff.
Yes, ma'am.
Yeah, I have a question. It didn't happen here in Cobb County, but it was in another state where there was a sheriff and an inmate. They happened to have had the same last name, but they were not related. And apparently there was some type of relationship. I believe she was supposedly transporting him to a medical
Right.
appointment and never made it.
The one that's been on the news for a couple weeks? Yes, ma'am.
And so can you speak to that in terms of whether that has potential to happen here in Cobb County?
Well, I think it has potential to happen anywhere, as you can see. We never can control what the human mind is going to do on any individual. We can only hope they're going to do the right thing and be the professional that we hope they are, that we hire them to be. But as I was speaking to Mr. Copeland earlier, what we do for our high-risk inmates and or subjects, we put an additional device on, which is different from Black Creek. We put a GPS tracking on them as well. And that was this question how he kind of led up at the infirmary. So we put an additional device on them as well so we can track them. As we go out of town or go anywhere else to retrieve an inmate that has to come back to Cobb County to stand charges, we put those devices on them. Immediately we pick them up and we can track them remotely all the way back into the jail.
Do you do background checks on your employees, potential hires?
Oh, yes, ma'am.
Background checks.
Yes, ma'am, absolutely. Last question, and we're going to have to wrap it up. Yes, sir. Yes, sir.
Isaac, I put on heart rates. Obviously, you must have some data on what would trigger that device. In other words, do we know that what the heart rates are for people who tend to have suicidal ideas, or who are becoming ill, those kinds of things, so that you wouldn't have a lot of false?
I think that's probably a question that would be better answered by the medical staff. I don't think suicidal ideation can be tracked with heart rate. What we know for a fact is if the heart rate gets below a certain level, an individual is at risk, is at danger. So what we're trying to do is we're trying to catch that person prior to them being in terminal distress, is really what we're trying to do. So for me to tell you, oh yeah, we have range of data, if you're a diabetic, you're gonna have a heart rate of this, you're gonna have a low heart rate of this or a high heart rate of this. I'm honestly not sure as a non-medical person that information actually even exists or is valid. But what I do know is that we can set a device with a relatively common to the population low heart rate as a default, but yet let the facility adjust that low heart rate alarm for an individual that they know that adjustment would be appropriate for. The system has that ability, and it's actually pretty easy to do. So we're not trying to box the entire inmate population into a particular low heart rate and a high heart rate range. We're not trying to box them into a specific range. The facility will be able, the medical people will be able to determine what their default levels are and then be able to adjust individual inmates' devices to their particular needs.
Okay, so those settings will take place after we have the units installed and up and running and all that kind of stuff.
I suspect there's a lot of information out there that may be available, but again, as a non-medical person, I am honestly not sure how relevant that information is to what we do. What we've done is provided a very adjustable tool for the medical staff to use, and I think they're the people that will best determine what those levels are.
I think what we'll do on our aspect is and consult with our medical staff and see what acceptable heart rate level should be for detainees. And when they determine if it dropped at a certain rate, what that should be set at. And also doing what a national average may be. But that's something we'll consult with our medical provider to provide those numbers and what it should be set to as we receive the device.
Yeah, you don't want your staff constantly.
No, it won't be us now. That'll be a professional.
Alarms every 3 minutes, oh my God. You know.
Right. Well, again, thank y'all for coming out this morning. We sincerely appreciate it. And thank you for sharing this information with everyone about the new technology Cobb County Sheriff's Office introducing along with Black Creek. So thank you so very much.